So there was an issue with the network, so I just have to change position because I noticed that that area that I'm staying, anytime I come live, network is always disturbing. Let me make sure that um I noticed that anytime I come live, that area I'm staying, the network is always disturbing. So if you're joining my live, you're welcome. Sorry for the interruption. I have to start the live afresh again because of network issues. So I'm starting afresh. I'm starting afresh. Network was really disturbing me, so I have to start afresh. So today I'm going to talk about an important topic that I want everyone to listen today, and that is chemical pregnancy. I know some of you might have heard it, chemical pregnancy. You might not actually know what it means. Let me see if I can write some things on, write some topics. I don't really know how to use this stuff. Question. It doesn't have any option for topics. Doesn't have any option to write topics here. Okay, let me just go ahead with my lives. For those of you joining my life, you're welcome. So today I'm going to talk about chemical pregnancy, just in case you're coming across my life. And feel free to ask me any question you want to ask me. I have to change position because the place I was staying before, network was disturbing. So I have to change position to see if this network will be stable. If this network will be stable, because I don't know. It's like traveling. They have, it's like a wave. If you stay in a particular position, you might not get the network. So I'm talking about chemical pregnancy. For those of you that don't know what it means, so you might be actually wondering, is chemical pregnancy actually a pregnancy? Yes, chemical pregnancy is a pregnancy. And is chemical pregnancy actually miscarriage? Actually, of course, it is. In fact, chemical pregnancy is a miscarriage that technically ends early within the first 5 weeks um, after implantation has stopped, after the pregnancy has stopped developing. How it happens is that after your egg, after you ovulate and your egg gets fertilized by sperm, then it swims and enters to the uterus. Either implantation do not occur properly, or maybe it, the implantation, there was failure in the implantation. So many things can cause what they call it, chemical pregnancy, and one of them is chromosomal abnormalities. Pardon me the way I speak. Anytime I speak fast, I'm always tense. So chromosomal abnormalities, I made a video on my channel about chromosomal abnormalities. So in chemical pregnancy, chromosomal abnormalities amounts of one of the most common causes of miscarriage. Chromosomal abnormalities amount about 50 to 70% of almost the end causes of end miscarriages, like early miscarriages. How it happens, if there's an extra chromosome or an missing chromosome, the body can naturally end this pregnancy. If you're coming across my channel, do wait to subscribe and hit the notification bell. Don't just scroll like that. So chromosomal abnormalities can cause these issues. So it's not something that you didn't do or something you did right or something you did wrong. Sometimes chemical pregnancy is actually not your fault. It's not the fault of your partner. It's not something that you have control over. That biologically happens without your control. And many women are that such such thing happened, because sometimes you might miss your period for 2 days, 3 days, and the period comes back again. That could be chemical pregnancy that you are not aware of. While some women, they might test positive for a pregnancy, then maybe few days later they test negative, and they start bleeding, their periods come back again. And when they go for an ultrasound, they will tell you, are you sure you're pregnant? Are you sure you're pregnant? And you say yes, I did a home pregnancy test. How come? And they will check your womb, your uterus, and they will not see anything there. No sign of pregnancy, no sign of gestational sac. And you'll be doubting yourself, but I did a pregnancy test and it was positive. How come there's no sign of pregnancy in my uterus? That's because of chemical pregnancy has already happened, and so many reasons can result to it. If maybe during implantation the embryo is not well implanted in your uterus, is implanted superficially, that pregnancy might not be sustained. It is okay when it's implanted superficially, your body start producing this pregnancy hormone, that's HCG. That is reason why when you run tests during that period, it might see a positive pregnancy test because there was an implantation, right? Because without implantation happening, there's no way that the body will start producing HCG. Implantation must happen after fertilization. Fertilization will first happen. If fertilization happens first, then implantation happens. So without implantation, there's no way your body will start producing HCG, that's a human chronic gonadotropin, that pregnancy hormone that detects pregnancy. So in chemical pregnancy, actually fertilization happened, implantation happened, but just that the body cannot, like the pregnancy ends, the baby stop developing. So chemical pregnancy is actually a pregnancy and also actually a miscarriage. Don't see it as something that is not, even though it ends early, because chemical pregnancy ends within the first 5 weeks. Because when you notice that you're already pregnant, when you already have a missed period, that's like 2 weeks after fertilization, that's 2 weeks after your ovulation. Medically they count it from your last period, that's 4 weeks gestation. By the time you already find out that you're already pregnant, that's already 4 weeks gestation. That's why some person that will say that I'm 2 weeks pregnant, they will be looking at you, how do you know that you're 2 weeks pregnant? Because pregnancy cannot be detected by 2 weeks. By 2 weeks, I don't by 2 weeks or 1 week. Like some person will say I'm 1 week pregnant, that's not how it's counted. Because if you say that you are 1 week pregnant, I'm not sure that ovulation has already occurred that period itself. So they count from your last menstrual cycle. So by the time you already find out that you're already pregnant, you're already that 4 weeks gone. Yes, you're 4 weeks gone. So this chemical pregnancy happens within the first 5 weeks, around your menstrual period, like around that period that you're expected to see your menstrual cycle. It might delay for 7 days, it might delay for 4 days, depending on how your body is. You understand? That is why some ladies, they might, and their period might be late. Some ladies, their cycle is very regular, that they hardly have any late period. So then if you imagine that first day you do not see your period, second day you do not see your period, third day you do not see your period, you should run a pregnancy test. Why some of them will just see it as nothing. Then maybe fourth day their period comes back. They say, okay, my period delayed for 3 days and comes back again. That might be a sign of chemical pregnancy, but just that you are not aware to test early enough. And for those of you that test early enough and get disappointed, maybe you test the pregnancy is positive on Monday, then before Thursday you test again and it's negative. Before you know, you start experiencing bleeding. Then you go for an ultrasound, they check you, they say, madam, are you sure that you are pregnant? You say, yes, I'm pregnant. I did a pregnancy this thing. And you even show them that, look at this two red, I tested this pregnancy this week. Then how come is it negative? They check again, I say, madam, are you sure you're pregnant? If you have not been in such kind of situation, you don't understand what I'm saying. You say yes, and they check you and they say, we are not seeing any sign of pregnancy in your womb. And you'll be panicking, is it ectopic pregnancy? Does this did this embryo go and implant in my fallopian tube? Actually, that might be, is not all, It's not all pregnancy that must implant in your that is missing in your uterus that must implant in your fallopian tube. Some of those signs are just chemical pregnancy. You can drop your question in the comment section. So in such kind of case, yeah, you notice that there's no embryo, there's no sign of pregnancy in the uterus. So if you wonder what really happened, that could be chemical pregnancy, and some persons are not really aware of it, and some doctors don't take their time to explain this incident that happens. So that is why it's called chemical pregnancy, because it is detected through hormones, like your hormones detect it, but image, the ultrasound could not detect it. It was not well developed for the ultrasound to, even before the ultrasound starts seeing it. So the pregnancy ends. Several reasons can cause it. Chromosomal abnormalities, and chromosomal abnormality is not something that you did wrong or you did not do wrong. It's not about your fault. It's not about, you say hi, I can see you, thanks for joining my life. It's not about what you did right. It's not about what you did wrong. It's not about being careful or being whatever. He say, hypothetically, I stole a fire alarm off my school hallway. What do I do now? Really? Why? You return it now. You return it back. So it's not about what you did wrong or what you did right, and it's not your fault. This kind of pregnancy is common, honestly. Chemical pregnancy is very, very common, more than you realize it. And it happens even without some women, even without you noticing it. A delayed period can be a chemical pregnancy, particularly if you are sexually active. If you are sexually active, a delayed period can be a chemical pregnancy that you are not aware of, that you do not test. Hi, is it Farah? Hi, thanks for joining my life. Thanks for joining my life. So chemical pregnancy does not mean that you are infertile. If maybe you might be thinking, am I infertile? Since you're not infertile. Chemical pregnancy does not mean that you're infertile. In fact, let me bust your bubble. Chemical pregnancy means that you are fertile. Yes. You know why? Thanks for joining my live. Make sure to subscribe. I'll give you the reason why I say so. The reason why I say so, because it shows that you ovulated. Because without ovulation, how will fertilization occur? Chemical pregnancy does not mean that you are fertile, infertile. It means that you are fertile. One, it shows that you ovulated. It shows that fertilization actually happened. It shows that implantation begins, but just that something stops it. Something stops this pregnancy, and that is reason why you should know what causes it. If maybe you have recurrent or repeated chemical pregnancy, like it happens and it repeated itself again, then you should get checked. Don't just keep silent. Then you should get checked. So it does not mean that you are infertile, and it does not mean that you cannot conceive. Of course, the ability to have a fertilized egg, to have implantation, that means that you can actually conceive. So chemical pregnancy does not mean that you are infertile, but that means that something actually stopped this pregnancy, and that could be hormonal imbalance. For those of you that have low progesterone, you should look on it, because low progesterone can actually disrupt your pregnancy, because progesterone helps to sustain early pregnancy. You understand? If there's anything like chromosomal abnormalities, where there's a missing chromosome or an extra chromosome, this can this can cause pregnancy loss, because the body can naturally end the pregnancy if there's an abnormalities. Honestly, if there's an abnormalities, the body can naturally end this pregnancy. So if you are joining my life, do wait to give a thumbs up. Do wait to give a thumbs up. Hit the subscribe button. Don't just go without subscribing. Ask me any question you want to ask. Let me connect with my audience. Ask me any question you want to. Sorry, the way I speak fast. Like anytime I am explaining something, I always talk fast, and it's like it makes me to stammer. But anytime I'm very calm and I talk, I talk like fluently. So if you are joining my life, hit the subscribe button. Like I was explaining about chemical pregnancy, what can cause it. So that is it for it. Even though it's an early pregnancy, like an early pregnancy loss that people do not see, it can actually be very devastating. No matter how early it is, it can be devastating. Imagine having hopes up and losing it. It's not easy. It's not easy. But if it keeps reoccurring, then you should see your gynecologist and know what exactly is the cause. If it's something that can be easily be fixed, then they fix it for you. But basically, it's not about how to prevent it. I don't think that chemical pregnancy can be prevented because it's not what you do or what you didn't do. It's not your fault. It's not your partner's fault. It's just something that naturally, biologically happens. You understand? The body getting rid of a pregnancy that stopped developing. Because once a pregnancy stops developing, normally HCG level drops. That's just how it is. HCG level drops. That is why you can test positive today. Then maybe some persons how this thing works is very funny. Some persons can test positive in the morning. Before you know it, in the evening, they are testing negative, and you ask yourself, what is wrong with what is wrong? What is wrong? If maybe this embryo is superficially implanted, it's not well deeply implanted in your uterus, your body will naturally produce this HCG. You understand? But once the pregnancy stop developing, once it's not sustained, this HCG level drops. It drops because the pregnancy is not valuable. So that is how it is for chemical pregnancy. Hi my people. Now is 8 minutes after 12 over here in Nigeria. So I don't know where you're streaming from. Let's connect. Let's talk. Don't be shy. I don't eat people. I just want to talk to my audience today. Ask me any question you want to ask. Any question at all. I can see you. Is it mobile? Where are you streaming from? Which country are you streaming from? Thanks for joining my live. I can see you. Mobile. Which country are you streaming from? How are you doing? How is your day going? So today I came to talk about chemical pregnancy. I know that you might have heard of chemical pregnancy. At least if you have not experienced anything like that, you might have heard of it in the internet. Like someone say chemical pregnancy, and you be asking yourself, what does it mean? What does chemical pregnancy actually means? Chemical pregnancy does not mean that the pregnancy did not occur. Of course, chemical pregnancy is actually pregnancy. Chemical pregnancy is a real miscarriage, not like it's a fake one. No, it's not. But the problem here is the embryo stop developing even before it could be detected on the ultrasound. You understand? So the embryo stop developing. So it's actually a pregnancy, but it ends early within the first 5 weeks, and so many reasons can cause it. So many reasons can cause chemical pregnancy. So chemical pregnancy does not mean that you are infertile as a lady. No, don't think that way. It actually means that you are fertile. It actually means that you ovulated, that ovulation happened. It actually means that fertilization happened. It actually means that implantation began, but just that the baby might not be well implanted. That could result to that pregnancy loss, because if there's a poor implantation or failure in implantation, it can result to it. And again, one thing again in this chemical pregnancy that people need to understand is if the uterus is not well, like for pregnancy to occur, the uterus is supposed to be thickened, soft, and rich in blood supply. If the wall of the uterus is thin, thin, and no enough blood supply to hold that pregnancy, implantation, even if the embryo is healthy, it will affect implantation. Sorry the way I speak. I always stammer. I don't know. Anytime I'm trying to speak fast. Hi. Hi. So even if the embryo is healthy, like the embryo, there's no form of chromosomal abnormalities in the embryo, but the uterus is not ready for implantation, it can cause chemical pregnancy, can cause early miscarriage, because for implantation to occur, the uterus is supposed to be thickened. The walls of the uterus, and the endometrial line is supposed to be thickened. It's supposed to be soft. It's supposed to be rich in blood supply. If any of this does not occur, maybe the lining of the uterus is thin and the implantation is not well implanted, that can cause early miscarriage. Hi. I don't know why my audience, I don't know why my fans today don't want to talk up. Don't want to talk to me. They are just leaving. Why? Drop your question. Where are you streaming from? Now is 12 minutes after 12 over here in Nigeria, over here in my country. So where are you streaming from? Normally I come online, sometimes I gist online, sometimes I just want to connect with my audience. Sometimes I talk about health related topics, just interact with them. I make health content in my channel. So several things can cause this chemical pregnancy, but one of the most common causes is chromosomal abnormalities, when there's a missing chromosome or an extra chromosome. So the body naturally ends the pregnancy. So it's not about what you did right or what you did wrong. You understand? So as a lady, you should prepare yourself for pregnancy. If you want to conceive, there's different things you should do. And one of them is by taking all these prenatal supplements. Take folic acid, take B complex. I'm not here to prescribe medication, but I'll advise you to see your doctor before taking any medication. Please see your healthcare provider before taking any medication, particularly if you have recurrent miscarriage. You have been having several miscarriage back to back, chemical pregnancy back to back. Because chemical pregnancy is actually a miscarriage. Yes, it's actually a miscarriage because fertilization happen, implantation happen. Pregnancy begins when fertilization happens, implantation happens, even if the baby stop developing. Even if implantation, the embryo do not implant very well, even if it's superficially implanted, as long as the body starts producing that pregnancy hormone, HCG, pregnancy begins. So chemical pregnancy is actually a pregnancy. Chemical pregnancy is actually a miscarriage, although it ended early, because before you notice that you're already pregnant, 4 weeks has already gone. Yes, medically they count from your last menstrual cycle, your last menstrual cycle. That's when they start counting. So before you find out that you are pregnant, you're already 4 weeks gone, and that is like 2 weeks, 2 weeks after your ovulation. That's like 2 weeks after ovulation. So happens, when fertilization happens, it takes 5 to 6 days for implantation to happen, because the embryo, like will I say, it takes its time and swing from the fallopian tubes, swing down to your uterus before implantation start happening. So even if the embryo is not well implanted and is superficially implanted, because once it's superficially implanted, the body will still produce this HCG. That's why you test positive during chemical pregnancy, there may be few days later you run a test again and the test is telling you negative, and you ask yourself, how come I was positive 2 days ago, how come it's negative today? Implantation might, if the embryo is not well implanted or is poorly implanted, it can cause such kind of thing. And the reason why it's called chemical pregnancy is because it's detected hormonally, like through hormone. Because when you go to ultrasound, they check it, they say, madam, are you sure you're pregnant? Because what we are seeing here, we are not seeing any sign of pregnancy, no gestational sac. How come you say you are pregnant? The only proof you have is just that your positive test results. Actually, pregnancy has occurred, but just that the baby stopped developing even before the ultrasound could detect it. And this happens within the first 5 weeks. Within the first 5 weeks. That's why when you have a delay period, you miss your period the first day, you miss your period the second day, you miss your period the third day or the fourth day, then later, maybe the fifth day, the period comes back again. That could be chemical pregnancy. And some women don't even notice. In fact, many women, when it comes to chemical pregnancy, many women are not aware of that they are already pregnant before their periods comes back again, because maybe they do not run a pregnancy test early enough to detect that. Imagine missing your period for 3 days, and the fourth day the period comes back again. You will not bother to run a test, right? Some women will not bother to chemical pregnancy. And one of the ways to detect it again without even a pregnancy test, you notice that during that period you see your period, the blood, you see a clot, a big bloody clot, if you understand what I'm saying. And that is not how you don't normally notice such kind of heavy clots when you see your when you bleed during your period. You notice some kind of reddish dark horse blood kind of clot. That could be a sign that something has happened, but it did not develop well, so the body ends the pregnancy. And another sign is bleeding. Maybe your period, you bleed like 3 days or 4 days, and you notice that this time around that you are seeing your period, that this bleeding is staying more than 5 days, 6 days, and it's not bleeding like normal, the way your usual way of the usual way you bleed. And that could be a sign of chemical pregnancy. Another sign also is that if you notice cramp, maybe at the type that you don't normally notice any form of, you don't experience any form of cramp during your period, like you don't, some women are like that, they don't notice any, but that particular period that your period delay for maybe few days, you notice that when it comes back, you start experiencing some kind of painful cramp. That could be a sign of chemical pregnancy. Heavy bleeding, blood clots, that kind of blood clot that looks as if there's a tissue growing, that could be a sign. You understand? So even if you do not take a pregnancy test, because not every women that are observant, like if you should miss your period for 2 days, you should take a pregnancy test, particularly if you are sexually active. That's how it should. You should take a pregnancy test, particularly if you're sexually active, so that you should know what goes wrong in your body. You understand? So why some women they might detect it early, because imagine if you are trying for this thing, a child, you try to test early enough. Then when they test early enough and later they notice that they are testing negative. I've seen someone that I think she came for a pregnancy test, and she did this home pregnancy test at home, I think in the morning. Then when she came and for blood tests in the evening, it was negative. And you be wondering yourself, how come? Is it that I was not pregnant or what? It might be confusing you, but you tested positive. You might even test positive 2 days ago, few days ago in the same week. Then you go back again and the test is telling you negative. And you be wondering, is it that there's no pregnancy, or maybe there's the there was an issue with the test strip? It's not actually like that. That could be chemical pregnancy, because once the pregnancy stops developing, HCG level drops. That hormone, that pregnancy hormone drops. Once the baby stop developing, once the pregnancy is not viable again, that HCG level drops. That is why you go back and test negative. And once that HCG level drops, the uterus starts shading. your uterus will start shading. That is normal. Once HCG, that's why in pregnancy, to know if maybe your pregnancy is succeeding or is progressing, is by checking your HCG level. The higher the HCG, that tells you that this pregnancy is actually progressing. But if the HCG is high, then falls back low again, then that should tell you that there's a problem, that something is interrupting this thing. But you understand? Imagine your HCG level rising, then coming down again in early pregnancy. That should point to you that something is wrong. And sometimes it's not something that you have control over. It's not something that you have power over. Chromosomal abnormalities can result to it. And this can come from the sperm of the man or from the egg of the woman. If there's extra chromosome or if there's a missing chromosome, the body can naturally end this pregnancy. Do you know that this Down syndrome, if you have heard of Down syndrome is a form of chromosomal abnormalities. There's some kind of chromosomal or abnormalities that are not sustainable to life, that the body that the development is not sustainable to life. Like maybe the body is developing abnormally, the heart is developing abnormally, the tissues are developing abnormally. The body will see this pregnancy and this thing is not worth it keeping.